Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as calcitonin. Its brand name is Miacalcin. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe calcitonin. We'll then touch on some examples of dosing, and then finish it off with side effects. I put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here will be the mechanism of action, or how this medication works. So calcitonin is a potent synthetic polypeptide hormone with similar effects to calcitonins of mammalian origin. It reduces the number of osteoclasts and prevents resorptive activity of the bone, resulting in a reduced bone turnover rate. In terms of indications or reasons we would prescribe this medication to a patient, well, we may see this medication used in the treatment of hypercalcemia, or an increased calcium level. It can also be used for Pegas disease, as well as postmenopausal osteoporosis. With respect to contraindications or reasons we would not be able to prescribe calcitonin, well, we just wouldn't give this medication to a patient who had a hypersensitivity to calcitonin salmon or other components of the formulation. Now for some examples of dosing with calcitonin. So in the treatment of hypercalcemia, we may see an initial dose of 4 international units per kilogram given either subcutaneously or intramuscularly every 12 hours. The patient may increase the dose after 1 to 2 days to 8 international units per kilogram every 12 hours, and then again a further increase may be necessary to 8 international units per kilogram every 6 hours. For postmenopausal osteoporosis, if a patient was using the injection formulation, we may see 100 international units intramuscularly or subcutaneously daily. And if they were using the nasal spray, we may see 200 international units, which would be 1 spray intranasally per day. You would want to alternate the nostrils each day. As with all medications, there are some side effects or adverse reactions that patients may experience while using calcitonin, so we'll go over some of those here now. Some patients may experience flushing with this medication, while others may experience an injection site reaction. This may happen about 10% of the time. Nausea can happen up to 10% of the time, and arthralgia or joint pain may happen in 4% of patients. Bleeding from the nose may happen 4% of the time, rhinitis 12% of the time, and sinusitis 1 to 3% of the time. These last 3 side effects are more so for the nasal spray. The more serious side effects would be hypocalcemia, or low calcium levels, a hypersensitivity reaction, seizures, abnormal urinary sediment, or cancer, which can happen up to 4% of the time. Alright everybody, that's all we're going to talk about today with calcitonin, or Miacalcin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. For today, take care.